So thank you guys all for showing up for our webinar. We've had a few technical difficulties, but we have made it past those. I want to introduce Craig, and I apologize, I may not say your last name correctly. Is it Scurato?
Yes, bingo.
All right, awesome. And he has come forward here about a year ago when we first started working on stuff for TFA, and gave us the ability to have sort of our own exchange for health insurance. And what that I think means to you, which Craig will definitely go into more detail as we move forward, is that we now have an access point for our members to go and get questions answered for health insurance, because it's all really changing quickly right now between different ACA requirements and what insurance companies are doing and not doing and stuff like that. How do you get tax credits, and depending on what I'm making, things like that. So we want to get some of those questions answered today and introduce you to the portal that you have access to as a member of TFA. So Craig, I'm going to let you guys take it from here.
Great. Thanks, Emily. So I think that the technology glitches are kind of a good metaphor for insurance. I think for all of us, it's not like it's rocket science or anything, but you do need to spend a little bit of time getting used to the rules of the game, some of the jargon, what buttons do I hit, and things like that. And so what I'm hoping to do here over the next 20 minutes or so is just give you guys a real basic level of understanding some of the words that are important, and then we'll just go into a live demonstration of the website that we have. And all of this stuff is linked behind the Texas Freelance Association site. So when you log in, there's an area that will redirect you to our site. And we'll have a team of people who are there to help you. There's plenty of things you can do online if you like to just do all that on your own. But we also have good old-fashioned people who can help you. So with that, I'll just kind of start going through the most basics as soon as I can advance my slide. So we are smack in the middle of open enrollment. So open enrollment on an annual basis is thereabouts going to start on November 1st and go through January 31st of every year. And what does open enrollment mean? It means exactly what it sounds. It's a time when anybody can purchase their own health insurance. It doesn't matter. There's no medical questions. Pre-existing conditions are covered. The rates are the same whether you bought a plan directly from Blue Cross of Texas, you bought a plan from healthcare.gov from Blue Cross, you bought a plan from your neighbor who's an insurance agent, you bought a plan from our website. All of the rates are the same, and they're simply based on your zip code, your age, and your smoking status, and that's it. And so the rates you see when you look at our website or any other are the rates that you would pay for the full year. And then every year, again, starting in November, you'll have an opportunity to make new selections. So again, drilling down on the time, the important time for people who want to have coverage start on January 1st is coming up next week, December 15th. You must purchase your plan, or enroll, I should say, in your plan by December 15th to be able to start on January 1st. You can make purchases through January 31st, but basically you have to make your election the 15th of the month, before the 15th of the month, to be covered on the 1st of the following month. So one of the things that I think is really important, especially for people in the Freelance Association, is a lot of folks are going to be coming from, as I did at one time, as Emily did at one time, coming from a large employer or an employer that sponsored a health plan. And whether they're a small employer or a large employer, there's usually something that allows you to continue. That's commonly referred to as COBRA. And if you are on a COBRA plan right now, so you've continued to plan from your former employer, this is the only time that you can actually just voluntarily drop that plan and enroll in the open enrollment. Outside of that, the only opportunity that you have to get off of the COBRA and onto your own plan would be a special enrollment, which would involve you moving or having a life change type of event, a marriage, an adoption, a birth of a child, a divorce, or waiting until the next open enrollment. And one of the key points that I want to stress is that you can't force a special enrollment event by not paying your COBRA premiums. So for those of you who are currently on COBRA, this is a really important time to kind of look. And for almost everybody, you're going to be better off financially for sure on the premium side to go purchase your own insurance than to pay the full group rates of your former employer. So that's a special note for the people with COBRA. And then the special enrollment period is what really happens from February 1st to October 31st every year, and there's a handful of contingencies on that, but those, like I said, are commonly you've moved, you've gotten married, you've gotten divorced, you've added a child, and that would give you a new opportunity, a 60-day window to purchase your own health insurance coverage. But the open enrollment's when the vast majority of people make that selection. So again, how and where? So like I said earlier, the rates are the same, but you can purchase via the phone, online. There are people called navigators. If you Google that, they're usually associated with social services type of organizations, or in person. Some insurance companies like Blue Cross, I'm not sure if they do in Texas or in Austin, but you're actually starting to see the major insurance companies have stores similar to a cell phone store like Verizon or Sprint, where you could go in and talk to them about insurance. You can also still have some good old-fashioned insurance agents out there who are happy to help you. And as I said, the key thing is, purchase it where you feel comfortable purchasing it, whether it's the healthcare.gov site, our site. Just purchase it where you feel comfortable, because the rate's the same. If anybody tells you they can get you a better deal on Obamacare plans or ACA plans, you should probably run the other way. And then finally, if you go to a site that's not healthcare.gov, that's not our Simplifi Benefits Exchange, what you're probably doing is entering yourself into a lead generation program. So the good news is you're going to find that there's plenty of people who are absolutely happy to help you make a selection of your health insurance. The bad news is your phone and email are going to blow up usually within a minute or two of you hitting enter on that. So just be cognizant of that. So let's talk about the basics. There's some basic definitions that people need to know when they're looking at insurance. And the first thing is the word premium. And a premium means the bill that you pay every month. So premium is something you're going to pay every month if you want to keep the insurance in force. And those of you who have homeowners insurance or auto or life, those are familiar terms, right? That's called a premium. When I think about insurance on the health insurance side, I like to visualize a seesaw. And on one side of it is premium, and on the other side is what does it cost when I actually use the plan? Right, or what are my out-of-pocket costs when I use this plan? And when the premium is low and on the ground, that means the out-of-pocket costs on the other side of the seesaw are high, and then vice versa. The government came up with a system which I think is pretty good. It's kind of the Olympic system, and they use a metal tiers. But if you take that and overlay the metal tiers over my seesaw visual, you'll see that the bronze is the lowest cost when you pay the premiums, but the highest cost typically when you use the plan. Then silver, then gold, then platinum's the exact opposite. Platinum is for somebody who has expensive chronic conditions to treat, usually meaning expensive brand name drugs. A lot of times it's worthwhile for them to pay more every month and to have lower out-of-pocket costs. And ultimately, the sum of both sides of the seesaw are what we want to try to make our best guess to compare, because what we want to do is put ourselves in an environment where we have our lowest total cost of financing our health care, which is both from the insurance premiums we pay and the out-of-pocket expenses that we have. And so that's when it comes into some cost-sharing elements. And those of you who have been in insurance plans before, which I think is most of our audience, you are familiar with terms like copay. That just means you pay a set amount for a particular service. That's commonly associated with doctor's visits, whether it's primary care or specialty. Sometimes in the more expensive plans, you'll see that for labs and diagnostics, so imaging, from a basic x-ray to an MRI, sometimes have copays. And RX, prescriptions have copays. And that's really one of the things that I think is really important to look at when you're comparing plans. And the next thing is deductible. And when I talk to people about the deductible, I like to say that is, think of that as first. That means, except for a benefit area that says the copay comes before the deductible or the deductible's waived, that's the first dollar amount that you're going to have to pay of eligible plan expenses before anything happens from the plan. So the deductible usually is the biggest thing that drives the needle on health insurance expense between bronze, silver, gold, and platinum. Then after the deductible's met, there's something called co-insurance. I think of that as just meaning cost sharing. And that is usually expressed as a percentage that the insurance company is going to pay, 50, 60, 70, 80, 90, 100, after the deductible's been met, and then the insured would obviously pay the reciprocal of that. So those numbers mean if I've hit my deductible and I'm into a co-insurance level, I might be paying 30 cents on the dollar. So if I have $1,000 of charges after my deductible, that means I pay $300 and the insurance company is going to pay $700. All of the cost-sharing elements are combined into something that's called your maximum out-of-pocket. And when we get on the demo, I'll show you guys how you can take a look at that and use tools to kind of compare that. But those are the basic cost-sharing elements of insurance. So if I'm thinking about how I purchase my own health insurance, which like you, I do, not through a group, but through purchasing on my own, to me the most important things are the prescriptions, if somebody's taking prescriptions, particularly if you're not taking generic prescriptions, and then the network, which is simply the group of physicians, hospitals, labs, inpatient, outpatient centers that are agreeing to take a discounted rate to quote-unquote participate in the network of a particular carrier. Most carriers have multiple networks, and when you start looking at plans, you'll see that the network is also a major area that drives the difference in price. So the smaller the network, the lower the price. If you don't go to the physician, or your physician is in that network and it's got hospitals that you would want to go to should something happen to you, then what's called a narrow or skinny network isn't necessarily a bad idea because you can save some money. But that's an important facet of plan design. So going back up on the prescription, if you have prescriptions, you need to make a list of those, and we've got a little, I'll show you where it is, we've got a little workbook that'll help you organize these things. You need to make a list of your prescriptions and then find out where those prescriptions fall on they'll either call it the drug list, the technical name is a formulary. But you're going to want to make sure that you know how those are covered. And so when people have expensive medicines, sometimes it's better to pay for a more expensive plan to be able to get that $500 a month prescription for a $50 or $75 copay versus having it be subject to the deductible first. But those are the kinds of math calculations you're going to need to do as you're trying to come up with what your lowest total cost is. And then again, on the network, you've got plans that have network only, and that means if you have service anywhere outside of their network, there are no benefits. And there are plans that have in-network benefits and out-of-network benefits. That means you can go any place you want, and if the service is covered under the plan, you'll get a reimbursement. But if you go outside of their network, you get hosed. There's no way to put it more professionally than that. So I usually try to purchase the broadest network and recommend that people do that. And because if you want to go to specialty hospitals, whether it's MD Anderson, whatever it is, you want to make sure that you're getting in-network providers because you're going to spend a tremendous amount of money, even though you have coverage, if you go to somebody who's outside of the network. So that's the basics in terms of the plan. One of the nice things about the Affordable Care Act was that the government said we all have to purchase insurance or we're going to pay a penalty. However, the government also said, look, depending on your household size and income, we'll provide you with some, you've probably heard them called subsidies, but we'll provide you with some financial assistance to bring the cost of the health insurance down. So there's been a lot of things that have increased the cost of health insurance, but the premium tax credits are there to help people in a pretty wide range of incomes, effectively get discounts. But they are actual tax credits. So they are based on household and income, household size and income. They can be advanced directly to the insurance company, or you could wait and do it when you file your taxes. I would say like 99% of the people have any premium credits that they get, they have them paid directly to offset the cost on a month-by-month basis. What I would warn you about is be conservative, especially if you're just starting out, or for any of us that are small business or freelance-based entrepreneurs. You don't really have a great idea of where your income's going to come from. Certainly, we hope that it's going to go up every year, but you just don't know. The tax credits are actually trued up when you file your taxes. So if you said you made a very low income relative to your household size and got a huge discount on your insurance, and then you ended up getting a significantly larger income when you filed your taxes, you're going to end up paying those tax credits back. Now, you're allowed to make adjustments if you see something happen. So let's say I think I'm going to make $20,000 this year, and then all of a sudden I get a big client and I'm going to triple that. I can actually go in and say, hey guys, stop paying all that money towards my insurance, because I don't want to owe $4,000 when I do my taxes. So you've got opportunities to do that. And then ultimately, all tax credits, as you would imagine, are processed through the government, and specifically through healthcare.gov. Our team will help you do that. Essentially what they'll do is they'll make it easier, and they'll kind of do an interview and a co-browsing session for you to get those premium tax credits. But just so you know, everybody ends up going through the government website to get that tax credit, because that's the only way that you can do it. So with that, Emily, I might take a breath, and if you wanted to have some people ask some questions now, or I don't know if you want to hold those off till later, you tell me.
I'm actually not sure, since we had to change this up, if the chat is working, and can people see the stuff on the chat? If you can, just write into the chat message over here. It should be on your right-hand side of your screen. If you have any questions.
And I can I'll go through the demo, and that might help. Now let me switch my screen share here. So, okay. So can everybody see? Emily, can you see the exchange? Yeah. Okay, great. So just to point out, so we use a partner. So this isn't just, calling Craig at his driving around in his car. So we use a big company. You've probably heard them advertise. They're most famous for life insurance, but they also do Medicare, auto, home, and healthcare. So SelectQuote's a company that we use to power our exchange. So you can see, you can immediately, if you're somebody who likes to play around on the web, great. If you're someone who says, I just want to call somebody and talk to a licensed agent, you can call this number. Again, they are not going to, we're not selling leads. This is my site. It's more of, really was built more for employer plans. So you're not going, you'll get callbacks, you'll get some emails, but you're not going to get bombarded by a bunch of different people, and certainly nobody from outside of SelectQuote. So those are the two ways. As you can see, we've got up at the top, when you navigate, there's resources, including video and information on home insurance or health insurance. So you can take a look at these things. You can get a little basic overview on what's going on. This is a pretty good booklet if you're a first-time buyer and you want to go through some of the things. You can download it as a PDF. Again, to me, the biggest things, especially for someone who's taking branded prescriptions, is getting a feel for how that's going to be covered. But let's go ahead and actually just kind of run a quote. So I'm just going to take somebody based in the Travis County. So you go in, and as I said, your rates are really just based on where you live, how old you are, and whether you use tobacco. I'm going to take somebody here, and we're going to just do like a single parent family. So I'm trying to do my age, let's say. And we're going to say that we don't smoke, and we're going to say, and let's add another child. And so this could be your actual household, or this could be just who you want to have covered. So let's say one spouse is working at Dell and you are freelancing. So you're going to want to maybe compare, well, what would the cost be to add everybody onto the Dell plan, or could we do better doing it on our own? So there are, if you see here, there are two different ways you could go. You could go just straight into plans, or you could check for tax credits to lower your score, lower your cost. You'll notice on our site there's a lot of things that have little links underneath them. If you click on those, you can always get more information. Acting a little clunky on me. So, okay, well, we'll go through. I'll show you how that works a little bit further. So let's check for tax credits. So I'm just going to put in a household size, and I'm just going to use 60 as an income. And keep in mind that as household size goes up and income's down, the credits are significantly different. If you look over on the right side of the screen, it gives you an idea, just kind of a ballpark. But as we see in this, I'm going to assume that this is a single parent household. So as you can see, 78,000 would be the maximum. So let's check for tax credits and see what we get. So our estimate is that this person who's 45 years old, who lives in Travis County, making $60,000 a year with 2 children, would qualify for $92 a month of a discount. So now we want to shop with tax credits. So you see there's a bunch of plans. I think there's 60-ish plans in this area. So a couple of things that you'll notice about the way the site is oriented. So like I said, there's when you hover over things, you can get a lot of different information. Let's see if this works now. Here we go. So if I hover over that, I can see that I can get basics on expense estimates. I can also go in and get expert advice, and some of them even have videos. So anytime you hover over something, you're going to have a bunch of different information. Right? So here's one where we could actually see a video if we wanted to on deductible. So there's a lot of different things that you can use. That's kind of funny. Kids explain deductibles. There's a lot of things to use to educate. One of the things, so if you see this scoring, they're trying to, this scoring is based on what the algorithm believes would be the lowest total cost of ownership, which, as I said, is a combination of premium and expenses when you use the plan. In most people's cases, that's always going to be these bronze level, the lowest cost, right? But you can go in and say, you know what, I want to personalize my plan scores. And the thing that I like best about this is, again, you can put in, these are very general, so it's making assumptions on you based on your age and utilization as we have as we age. But you can come and either decrease or increase that. You can say, you know, there's some other things in here that might be important to me. But the thing I love the best, especially for those of you who are seeing specialists that you believe to be irreplaceable, you can actually search by a doctor's name. So Emily and I did. There's usually a good old Dr. Smith somewhere. So, so if I wanted to see Dr. Todd Smith because I know I'm going to have knee surgery next year, and Dr. Todd's real important to me, I personalize my plan scores, and now the only thing we changed is the doctor. So the plans as they come up should be the same, but now I can see this doctor who's really important to me, and I know I want him or her to be in network. Now I can look at the plans where he is. So he's in Blue Cross, and it looks like United Healthcare. So now I can see this, and I know this because I hover over this, and it says Dr. T. Smith out of network. I hover that, and is available in my network. So that's a nice tool, and you can search up to, you know, I think 5 or 6 doctors at a time. So that, to me, that's the best tool. That's the reason why I use this partner, because that's the best tool because it really saves people a lot of time. But again, if you look at filtering And again, this is a great site for you to do your basic homework. And if you spend even 15 to 30 minutes on this, you can narrow things down pretty quickly. But you can sort by score, by price, like what's the cheapest price. You're seeing the price is reflecting the discount that we put in. The actual price is down here below. So just so you know that. But you can filter by doctors, by plan types. So again, this will give you a definition. Generally speaking, I personally like a PPO. That means you can go to any physician you want, right? So you can see providers outside of your network. It will definitely cost you more. For me personally, as my buying preference, I like that. There are other people who say, you know what, I'd rather have richer benefits, right? So I'd like to have a lower deductible, or I would like to have the predictability of having co-payments for things. And I'm willing to go in-network only. Well, that's great. If that's your personal preference, that's absolutely what you should do. So you can see really the difference between an EPO and an HMO. An HMO, traditionally, your personal primary care physician has to refer you to care outside of their office. In an EPO, it's in-network only, but typically you don't need a referral to see a specialist. So that's all, again, defined for you. You can look at different features. Again, you can put different things. Some people, especially young and relatively healthy, say, you know what, I'd like to open up a health savings account. There are certain plans that allow you to do that. And so maybe if I save some money on those plans, I can put some money away in my health savings account for a rainy day. So other people might say, you know what, I want a copay for generic drugs and a copay for office visits. That's important to me. So I don't know that we have that with Dr. Smith because that's not coming up. I could have also, so I'll unselect those. But as you can see, you can play these around. You can do this all the way to metal tier, to deductible, or you might say, you know what, I only really like Blue Cross, so I don't even want to look at all these other plans. I know Dr. Smith's only in Blue Cross, so I'm going to look at these plans, and I'm going to then try to do compare. So the first level is, you might say, you know what, I just want the least expensive plan, so let's just check this plan out. So I just clicked on details. You're capturing some information, and you're kind of going on down the line with a lot more detail, obviously, than the high level. So again, you're seeing that there are all kinds of ways to learn about this unintuitive product, and gives you a lot more information. This is nice if you want to go and find about facilities. That's a good thing to do. What I really want to point out when I'm looking at just a single plan, what I want to point out is you go all the way to the bottom, here's the drug list. So if I'm taking prescriptions, I want to know what category the drugs fall into for the specific name and dispensed strength and number of drugs I take. So that's where you click on the drug list, and then every carrier has a little bit of a different link. Sometimes you can search right on them. Usually, as you can see, this one's downloadable. It's a pretty huge document, I'm sure. On my computer, this doesn't have a live click, and sometimes it would. But you can go and search for that drug by downloading as a PDF and typing in the name. Summary of benefits, plan brochure, so you can get all of this information. So it's, it'll probably make your head explode, but you can really dive in for some detail. Oops. As you can see, if you close that, I should have clicked back to plans. Sorry about that. Great. All right. Well, how about that? And we're cruising along, Emily. So what I'm going to do is just try this all over again. Because really the last thing here I want to show you guys. So just, again, from a comparison, you can compare up to 3 plans. So if you narrow down what you wanted, then click compare now. This gives you a really good side by side. And so again, just for point of emphasis, what's really important is the deductible, because that's first, and that's really going to drive the needle on your out-of-pocket costs. So if I'm looking at these two plans, they're pretty similar, right? But this Humana plan has, another $450. And these kinds of plans that are very low cost are typically going to say, yeah, you need to spend all of that money, and then after that, you see the out-of-pocket maximum is exactly the same as the deductible. So that means after you've hit $64.50, then the insurance company is going to pay the rest of it. So what that really means is, if you blow your knee out, it's going to cost you $64.50. If you have a heart-lung transplant that costs $2 million, it's going to cost you $64.50. So to me, that's kind of, I focus on personally out-of-pocket max more than anything else when I'm comparing, but it just depends on what your personal situation is and how you buy things. So again, this just lets you go through and look at the different plans and see where there are differences as you try to make a good decision about purchasing your health insurance. So I won't make that same mistake twice. You click go back to plans, and then you can kind of re-go and do all of that. So that was fast. I didn't see any chat questions, Emily. So barring that, I might plow into kind of wrapping up.
Yeah, go for it. I didn't see any either.
Okay. And let me get my little screen share going here. So the next thing is, and again, these things I won't belabor, but if you go onto the TFA site, you'll see we have a service bundle. It's actually a good Dallas-based company called Fresh Bennies, which is a really great way to augment your health insurance. And whether you're purchasing health insurance through your spouse's employer, purchasing it on your own, you've got Cobra, you've got VA, TRICARE, whatever it is. There's a bunch of different ways to get your coverage. What's nice is to have somebody who doesn't work for one of those insurance companies being the primary person helping you navigate the system. So what we've done is we've put together a bundle through Fresh Bennies, and it includes a teledoc service, which is an unlimited phone consult, so it's no cost when you use it, and it's for the whole household. So it's $12 a month, and that gives you unlimited phone consults where they will actually call in prescriptions if they think it's warranted. They're obviously not going to prescribe pain meds or stuff like that, but it's great for people like me who travel, and sometimes you forget to bring your prescription and you need just a week continuance, or you're got a sinus infection and you don't want to go to urgent care and sit around with people. You know what you need. You've got a flu, whatever. Teledoc's a great fit for that. There's an eDoc, which is an online specialist consult, which is really cool, again, for the whole household, no cost. A very robust prescription savings. And so as we all continue to go forward, the prescriptions become a bigger and bigger part of our kind of total medical costs. And that will change every year, even if you stay with the same insurance company. So we've got another tool that you can look up to see where you can spend the least amount of money on prescriptions, and you'd be surprised. Sometimes our discount program is a better deal than buying it with the insurance company's discount program, and especially if they've dropped that particular medicine off their formulary, which is happening more and more as these really super high-priced drugs come out. And then most importantly, as a personal health advocate, and I just call this a personal health concierge. So it's anything as mundane as saying, you know what, I'm in this Blue Cross network. I know Dr. Smith's in it, but I need to find a primary care doctor in my zip code. You call them up, they'll find one for you. They can even help facilitate making appointments. Where they really roll their sleeves up is if you get into billing issues or you have to negotiate some of those out-of-network bills. They'll actually do that for you. It's all free. And again, once you're paying your $12 a month subscription, it's all free for the whole household. So that's something you can learn more about on the site. And then as a wrap, just to say again, so if you want to have your coverage start on January 1st, you must complete your enrollment by the 15th. Typically, you can wait through the end of the month to pay. Really, you could technically wait till the end of January to pay. Just know they're not going to do anything about getting you onboarded other than to keep you kind of in a holding pen until you pay. So if you want to kind of play around with how you do that, you can, but just don't expect that, the moment you pay on January 15th, that on the 16th you'll be able to go to a pharmacy and they'll be able to look at your ID card and know that you're an activated member. So 12/15, I would advise to sign up and pay, but you don't have to pay. If you don't have coverage for at least 10 months of the year, you're going to pay a 2.5% penalty next year. So the minimum penalty is $695 for an adult and half of that for a child. So you might not remember looking at this, but the hypothetical single-parent family of 2 who didn't have insurance making $60,000 is going to pay a $1,300 penalty when they file their taxes in 16. And ultimately, I'm all about trying to find the least expensive source to get the kind of coverage you need. Sometimes that comes from COBRA, because maybe you've already met your deductible when you've left your employer and you'd have full coverage, 100% coverage for the rest of the year. COBRA might make the most sense, even though it's more expensive. Again, thinking about that seesaw. Spouses, employers. Sometimes the spouse's employer, contributes a significant amount. It's worth taking that money. Even if the rates are higher, if the spouse's employer contributes, your net cost should be lower. Those of you who are under 26, especially if your parents already have children covered under their plan, there's really no incremental cost to add you. So that's a good place to go. Our veterans have VA, or depending if you've fully vested in your 20 years, have a TRICARE option. Medicaid and CHIP. In Texas, that hasn't been expanded, but the CHIP program can be a good program for single parents, especially if they're leaving a corporate job and having to insure their children. You can actually get children covered on CHIP and then still get a subsidy to purchase the adult's health insurance. And then lastly, there's a kind of a new wave of things that maybe some people have heard. Not a fit for everybody. It's not insurance, but it counts as meeting the coverage requirement under the Affordable Care Act, and it's called Health Sharing Ministries. The one I'm most familiar with is called Liberty Direct. And these are not insurance, but they are truly what they say. They're health sharing ministries. So generally speaking, Christian-based. Liberty Direct's a little bit more secular, but that's something worth checking out because it's a very low cost. It's a kind of an old-fashioned method, but that's worth checking out as well. And those are the sources of coverage. And I guess, Emily, I'd kick it back and see if there's any questions or anything. I feel like I would be saying Bueller right now, which I will. Got to get a Bueller reference, but barring any questions, I really appreciate your guys' patience for our start, and I appreciate you spending the half hour or so with us, and thank you, Emily, for the opportunity to serve the TFA.
And thank you so much for the information. Let me know next time you're in Austin. Maybe we can set up a live Q&A, invite everybody in so people can ask questions to your face.
Awesome. Sounds good. Sounds good.
Okay, guys, we're going to wrap this up. Thank you so much for coming. The replay will be sent out hopefully this afternoon. I'll get that edited so that if you missed some of the beginning, you can catch up on that, and we can also send it out to the rest of our association members. Thanks again, Craig.
Thanks, Emily. Bye.
Bye.